Hello, this is Dr. Tyler Hamel, Kingwood chiropractor and nutritionist, and today I wanted to answer a question that a patient had asked the other day about wear and tear. He said, if you're an athlete, what breaks down quicker? Is it more of the joint side of things, or is it more of the muscle side of things? So I'll try to answer that in the simplest way that I can. And he also said, well, what would you recommend based on your experience? What would you recommend to help prevent the wear and tear, or kind of balance out the wear and tear? And with the whole idea, in doing that in order to prevent injury. And a lot of this could be geared towards athletes or people who work out a lot. And the reason being, if you are competitive in golf or tennis or CrossFit or football or basketball, if you're not able to play because of an injury, then that's a really difficult thing to deal with, like especially if you're a professional. But if you're like some of us who just get out there and want to compete, and you're playing tennis or golf 3 or 4 days a week, and now you can't because you have some kind of an injury, then that's no good, right? Both physically and emotionally or mentally, it's pretty tough. So what wears down the quickest, and it can definitely depend on the sport, but let's just take, common sports that are wear and tear. So it could be football with the running and the hitting, and it could be marathon training. It could be playing tennis on a hard surface, right? Like a lot of those sports they're really tough on the body, tough on the joints, tough on the muscles. So what wears down first is it's really both are going to be wearing down at the same time. So think about, you have muscles, and you could have, say, your hip joint or your knee joint or your shoulder joint, and we're doing something repetitive over and over and over and over and over again. So yes, the joint obviously is moving, and it's going to have some kind of wear and tear in the joint. But also, say in the shoulder, the muscles and the rotator cuff tendons, those are also going to have overuse or repetitive movements, right? So how do they relate? So whenever you have a joint, you're going to have muscles or tendons that are surrounding the joint. And based on how well those muscles or tendons are moving, or how flexible they are, how strong and stable they are, that's going to affect the amount of wear and tear on the joint. So commonly, super commonly for the shoulder, we see that the rotator cuff muscles were very strong coming in internally, we're very weak going externally. So this is why we see baseball players, we see swimmers, we see volleyball players, we see handball players, we see tennis players that always have some kind of rotator cuff tendonitis, because the overuse, right? There's an imbalance between strong this way and not as strong this way. So, and that, when we have an imbalance in the muscles or the tendons, that puts extra stress on the joint. So keep that in mind. So those two things go together. So that doesn't matter, say if that's in the knee, right? And we have some imbalances in the muscle with the quadricep and the IT band and the hamstring in the back. If there's imbalances in those muscles, yes, it's going to put extra strain or stress on the knee. And sometimes we think, well, I pulled my hamstring, and I really need to get my hamstring better, right? That's what people think. But there's a reason that the hamstring gets pulled, right? There's significant extra stress on the hamstring, and it can handle it, and then all of a sudden it can't. So it's not just the fault of the hamstring, but how about the glute muscles? How about the IT band? How about the hip flexors, right? When those muscles are not working like they should, they put extra stress on the hamstring, and that's going to eventually cause it to fail or get injured. So the answer, which one wears down, the quickest, it really is both. But I'd say, depending on the person or the individual or the athlete, you can have one that wears down more than the other. So say if we have marathon trainers and it's a lot of wear and tear, right? They're training 5 miles a day, sometimes 10, sometimes on the weekend they'll run 18. Lots of wear and tear on the joints, right? The muscles are getting worked, but the joints are under significant stress. And if with a joint, if you don't strengthen the muscles around the joint and stabilize the joint, then you're going to have lots of wear and tear in the joint itself. So that's why we see a lot of repetitive overuse. Marathon trainers for sure, right? Starting to have knee joint problems, or they say arthritis, or they have meniscus issues, or maybe all of the above. So what can be done about this? And this is in my 20 years experience of seeing athletes come into my office. A certain percentage of patients coming in are just hardcore athletes. Most are not, but there's a certain percentage that are. So hardcore, like competing in leagues, could be baseball, tennis, golf, CrossFit, just hardcore. You know, maybe they were athletes in college and they just kind of continue that competition after. So this is what I notice is that lots of times the people they're continually working on their sport or training on their sport, but they're not really working on, say, building muscular strength or stabilizing the joint with balancing out muscles. So if I were to recommend something, it would be, yes, obviously you have to train for your sport, you have to practice for your sport, but you need to do the preventative stuff outside, right? So specifically for the shoulder, we're very strong this way. So you have to work on improving external rotation. If you're a swimmer, a baseball player, handball player, golfer, even tennis player, you have to work on external rotation. Just playing tennis all the time or handball or golf is not going to strengthen your external rotation. You have to do something besides your sport to strengthen it. So there's exercises that you can do to strengthen external rotators. And I would recommend for your parents watching out there, if your kids are in those throwing sports or swimming, start working on those or strengthening external rotators from a pretty young age, because they're just getting super, super, super strong coming internal and not external. So it's creating that imbalance. So much more chance or greater chance for injury as a kid gets older, right? High school, college, and beyond. If you do not balance out everything, there's a much greater chance of injury. And let's face it, that's what people are trying to avoid, whether you're a competitive high school athlete, college athlete, even professional athlete, or a weekend warrior. You don't want to get injured. Like, what can you do to prevent injuries, right? So you can get out there and enjoy doing like mini triathlons, or go do an Ironman, or go do a CrossFit competition. That everybody wants that. They want to know what they can do not to get injured. Injury means, kind of failure, or you're mixing up or ruining your routine, and that just that makes a lot of people miserable. So injury prevention, that is a key. So that's what I would recommend on the muscle side of it, right? Or go see a practitioner, a chiropractor, or a corrective exercise specialist. Get evaluated for muscle imbalances. And this is when my patients come in, even if they're non-athletes, I evaluate them for muscle imbalances, because postural stress creates muscle imbalances. Say for the neck, will be very tight and strong this way, very weak going back the other way, very weak muscles between the shoulder blades. And that all needs to get better in order to help patients, say, coming in to see me with neck pain or back pain or things like that, right? So you want to know what the imbalances are, and then how do you work on it, right? There's simple things you can do. You don't have to go to the gym for 2 hours a day. There's simple things you can do at home, simple equipment to help balance out muscles. The second thing for joint support, there's plenty of natural things you can take. So we have glucosamine, collagen peptides is huge right now. That's a big, big thing. Again, just trying to support the cartilage, the meniscus, things like that. We just don't eat enough collagen in our diet, right? It just isn't there anymore. So glucosamine sulfate, we use collagen peptides. There's amino acids too to help protein or amino acid to help support or repair the joints of the body. There's fish oil to help with inflammation. And there's many more things that you can take too, natural things that you can take to help support the joints, right? Joints break down over time. As we get older, they break down. Muscles also, we lose muscle mass over time, especially as we get older. We lose a certain percentage of our muscle mass every single year. So is it important to do weight training or strengthening exercises? Yes, and especially if you're over 40, because they start to decline year after year after year, muscle mass declines. So you can counteract that by doing strengthening exercises. You don't have to bench press 500 pounds or squat 800 pounds. You can do simple exercises to strengthen, squats and deadlifts and simple things like that. They're just good functional exercises to help strengthen the body, strengthen the core. That's a key thing. So that's what I would recommend. Hopefully I explained it in a simple way. We're just talking about wear and tear of joints and muscles, tendon, ligaments. And also when you have an injury to a joint or muscle tendon, the key is to give the body what it needs to help heal and repair. So we need all those nutrients to heal and repair. We need to do the right exercise. We need to get rid of inflammation. Those are all key things. So I'm Dr. Tyler Hamel, your Kingwood chiropractor and nutritionist. Again, today talking about wear and tear, what it's all about, what you need to do to get better. If you have any questions, post it in the chat box below. I'd love to answer those questions, and I'd love to have the opportunity to see you guys. If you're an athlete or you're not an athlete, you've had neck pain, back pain, shoulder pain, sciatica, knee pain, and it just isn't going away. Maybe you've tried other things. Maybe you've done medicine and physical therapy and cortisone shots and things like that, and it just isn't working. I might be able to give you a different perspective just with my experience. I've been doing this for over 20 years. I've seen a lot, and I think I've helped a lot of people over time with their injuries and given them things that they can do to help them not only get better fairly quickly, but also that they can continue doing to make sure they stay healthy in the future. So again, Dr. Tyler Hamel on this Wednesday. Happy Wednesday. Make it a great week, and stay tuned, and we'll be doing more videos in the future. And you guys have an awesome day.